So liberal Christians would say that in an imperfect world there are circumstances where a termination of a pregnancy may be the lesser of two evils. For instance, some embryos may be seriously disabled, and if they were born alive, their only prospect would be immense suffering and early death. Or where the pregnancy is the result of a rape, and an abortion may be necessary for the recovery of the victim. Or maybe a termination may be needed where there is a risk to the physical or mental health of the mother and or her family. So the Anglican Church, liberal Christians, do accept that sometimes abortions will be necessary. They would say that you need to do the most loving thing and that you need to treat others as you'd wish to be treated yourself. Okay, now attitudes to fertility treatment. Now, of course, the fundamentalist Christians, Roman Catholics, and the liberal Christians have got their same views. Fundamentalists are always against it for our 7 already stated reasons, whilst liberal Christians would be against it in principle, but accept it on compassionate grounds, and we know 2 teachings to support that view. This would be the same for cloning, where someone is producing under scientific and clinical conditions an exact genetic replica of a living person. Fundamentalists be against it, liberals would be against it in principle, but would say that perhaps if the cloning was changing a hereditary disease that could be eliminated and therefore improve the quality of somebody's life, they might accept it. With regard to fertility treatment, you need to be aware of a couple of techniques that are used to create artificial life. First of all, we've got in vitro fertilization, or test tube babies. This is where the ovum, the egg, is removed from the female and fertilized in laboratory conditions with a man's sperm, and the fertilized ovum is then put back into the woman's uterus. Problematic issues exist with this because normally you have multiple fertilized ovums going back into a woman, and some of those will then be later aborted. This raises ethical issues about murder and about choosing the right between living and dying made in a laboratory situation by a surgeon as opposed to God making that decision. So test tube babies or in vitro fertilization, very successful nowadays, but does lead to the termination of fertilized ovums or embryos which would have gone on to become human beings. There's also the issue of surrogacy. Surrogacy is a form of fertility treatment where donated eggs and sperm may be inseminated into a host mother, and that woman will carry the fertilized ovum and embryo to term and then give the baby to the parents. This raises issues about life being, the body being a temple, and life being created by God as a gift, and fundamentalist Christians would raise objections to this. Liberal Christians would be compassionate towards couples who are going to be good parents, and after all, God has instructed human beings to populate the earth, and so it would seem sensible that if human beings can perform surrogacy or even in vitro fertilization, then they are carrying out God's work. If we move on to euthanasia and suicide, there are several forms of euthanasia that you need to be aware of. First of all euthanasia is either voluntary or involuntary. Euthanasia being assisted suicide, where someone helps someone else to die. So voluntary euthanasia would be where someone is conscious and has asked someone else consciously to help them die. Involuntary euthanasia would be where someone is unconscious and is not in a position to be able to ask somebody to help them to kill themselves. They might be in a deep coma, or they might be on a life support machine. And however, euthanasia will be carried out without their consent. Now, it seems very difficult to distinguish that between that and murder. Nevertheless, you've got voluntary and you've got involuntary euthanasia. Now, both of those can be carried out passively or actively. Active euthanasia is when you do something to bring about somebody's death. So it may be that you inject them in a hospital with a large amount of morphine or analgesic drug to bring about their death, or sometimes people are suffocated. That would be active euthanasia. Passive euthanasia is when nothing is done to stop somebody dying. So, for instance, in a road traffic accident, somebody may ask to be allowed to die. This would be voluntary passive euthanasia. So you've got voluntary and involuntary euthanasia, and they can both be carried out passively or actively. Obviously, the Christian viewpoint would depend on whether you're a fundamentalist or a liberal. Fundamentalists are always against it. Liberal Christians would say that in a perfect world, euthanasia wouldn't need to be carried out, but we don't live in a perfect world, and so sometimes there would be need to be compassionate.